The school year is concerning for many parents, not only for their child's education, but for their health.
Tonight we're joined by Prisma doctor Robin LaCroix. She is a pediatric infectious disease specialist with Prisma Health, Children's Hospital Upstate. Thanks so much, Dr. LaCroix, for being with us. We'll start out by this. The coronavirus is new, we know that, but the medical community has been studying this disease for months, and you read all kind of things about the transmission and infection in children. But what are some of the biggest concerns from doctors at your facility, yourself, and across the country?
So certainly we've been fortunate, and children have fared better than the elderly and some of the folks that have complex medical conditions. And so children have had a less severe effect from acquiring the virus, but we continue to see children who advance on to the multi-system inflammatory syndrome of children and do become ill with the virus. And so continuing to have families monitor those children for illness and seek medical attention when their children are ill.
Now, the CDC is saying people who can't socially distance, wear a mask, and are around large groups of people should get tested routinely. So would you recommend this for children too?
Certainly the CDC has not proceeded into the pediatric world with that. It's come about in a lot of the communal settings, such as prisons, some of the nursing homes where they're not able to have the residents mask, and other situations where you have groups congregate together, but they have not yet come out with any recommendation like that for children.
And Dr. LaCroix, this may be a hard question to answer, but we all are talking about a vaccine. That's all you're hearing about right now. Is this something children should get? What is your advice about this vaccine? Will it all be, by guidelines, by the CDC? What's your thoughts on that?
So clearly we're excited that the vaccine progress is really moving along, and several vaccines are entering phase 3 trials, which means that we have learned much more about them and we're understanding more about how well they're working. So the vaccine release typically occurs first in the adult population, and particularly targeting those at highest risk for severe disease with the virus. So we will certainly await additional trials in children to understand their immunologic response before it would begin to be offered in that population.
All right, Dr. LaCroix, thanks so much for joining us tonight. I know these kind of things change. We've seen by the week, but thanks for getting us some answers tonight, and I'm sure a lot of parents very much appreciate it.
You're welcome.